Welcome back. Have you ever thought about getting involved in medical research but wondered how it works? Today, we're pleased to welcome Dr. John Pappas, Medical Director and owner of Kentucky Medical Research Center, to tell us more about some local studies and research in general. Thank you so much for being with us today.
Certainly, Christy. Thank you.
Well, tell us a little bit about your background and sort of how you got involved in research and what your specialty is.
Sure. Well, I'm a specialist in internal medicine and a long time ago founded a large internal medicine group here. Maybe about 30 years ago, initially started to get involved in clinical research through University of Kentucky and have been involved in clinical trials for about 30 years since that time, and most recently with Kentucky Medical Research Center. And in terms of why getting involved, it's interesting. You can really affect the lives of maybe a few thousand people in the life of a practitioner and affect their health by being a practitioner. However, with clinical research and coming up with new and effective therapies, sometimes you can affect the lives of millions or even tens of millions of people. So that was really the draw for research.
Now, with some of the research that's done, are the trials always with new treatments, or what are some of the things that folks could get involved in?
Well, there's different things that we do study. Some of the things are already medications that are already available to the general public. For example, we're doing several trials now for overactive bladder, for gout, as well as for diabetic neuropathy, where medications are already available. But most of the time, we provide treatments that are not yet available to the general public. For example, sometimes we look at disorders that for there's no real effective treatment, like premenstrual breast discomfort, irritable bowel syndrome, or low sexual desire in women. And sometimes we look at treatments that significantly advance care, maybe oral insulin or a once-a-month treatment for diabetes. We've looked at some pretty revolutionary treatments for pain, for arthritis, or for pain after a shingles attack. Even allergies. You mentioned you had children, so rather than giving allergy shots, you can actually give medications sublingually or by mouth rather than a monthly shot or even a weekly shot. So sometimes these are really game changers and really do change the treatments that we are available for the public.
Well, you see there at the bottom of your screen the phone number and the website to get in touch with Kentucky Medical Research Center and to learn more. If folks are interested, what should they do?
Certainly they can contact us one of several ways. One, they can stop by the center, 354 Waller Avenue, or call at 225-5672. Or maybe the easiest way is to fill out a questionnaire on our website, KentuckyMedicalResearch.com. And it's a short questionnaire, and somebody typically will contact them within a few days.
Wonderful. Well, thank you so much for taking the time to share that information with us. And as you mentioned, not only could you possibly get help for yourself, but help others in the research opportunity as well.
Certainly, Christy.
We will be right back with the last check of your forecast.